Hello, ladies. Welcome back to Sisterhood Redefined, Decoding Our Bodies. Now, we have this trend of young people that are all just looking at taking care of their bodies, eating healthily, drinking babu, boboa tea, I don't know what it's called, matcha, and all of those things. So, I'm trying to say that we're in a generation that's really taking care of their health. And as a result, a lot of young women don't always feel like they can be affected directly by cancer or breast cancer. Namhlanje, I'm joined with my friend Duleti, and we're just gonna try and unpack some of these things that go through young people's minds and how we can go about sort of empowering ourselves with knowledge so that when a young friend goes through this, we're able to support, or even when we go through it, we can most certainly be able to empower ourselves with knowledge. So let's see how you
I'm well, thanks, Anita.
say hi there.
Hi.
So, just in this context of young people often thinking that they can't get affected by breast cancer or anything that has to do with cancer, what are your thoughts on this, and what have your experiences been regarding this?
Honestly, it scares me, but it also drives a curiosity because I know about two people who suffered from breast cancer, one 28, one 32,
Sure.
and it just makes me wonder, aren't we supposed to be healthy? You know?
Mm. I mean, I do think that we are all in this trend of trying to exercise. We're eating healthy, we're chasing those glutes, that six pack, those calves. And because we've been taught that exercise and healthy eating means you're healthy. But it's important that we understand that as long as you're a person that's living on earth and you're breathing, disease does not discriminate. You can exercise until you look like whatever, but disease does not discriminate.
Yeah.
And this is why it's important for young people to not just think that breast cancer is something that can affect only our mothers and our grandmothers, but it's something that younger females can also go through. And this is why it's important for people to do those self checks often, because disease, guys, doesn't have an age, eh? It just pops, yeah, just comes unexpected package by the door.
Okay. So what exactly is it? Is it lifestyle because we're in the groove era? Or is it stress?
I'm a groove era.
I'm a groove era.
Yeah.
I'm a groovist.
Yeah.
Or is it stress or even bad luck?
Well, yeah, I wanted to talk about that groovist era. We are in that era. We've evolved, and I think in South Africa, we unfortunately are a country that's full of people that enjoy their alcohol, and it's nice, it's fine. But I think it's also important to understand that you always need to keep a balance. I mean, even at groove, if you're always doing when a vosho is your go-to move all the time, sooner or later your knees are gonna start to complain, right? So similarly to alcohol intake, it's important to keep that balance because alcohol can have an effect on how your genes react, right? And how your cells grow. And again, that's the groove era. So alcohol, again, speaking to also, like, we're in that era as well of corporate baddies, corporate girls and all of that. So there's a lot of stresses. We young people, we have ambitions, we're chasing those dreams, and just getting that bag. And oftentimes we don't check in with ourselves and understand what's going up in here, what's going on mentally. And believe it or not, actually October is mental health month.
Yeah, exactly. Yeah.
So mental health, it's important for you to check it because stress levels, they increase cortisol in the brain, and this can also have an impact on how your cells behave. So it's very important to also watch out for that. We're also in the hubbly era, in the chilling zone era and all of that. So it's also important to understand that those can have a negative impact. I do want to say that they may have, not necessarily they will, because you'll find that someone will say, yo, I'm so healthy, I'm exercising every day, and I got cancer at a young age, but that person who's been smoking like a chimney for the past 27 years is still cancer free. So your genes also have a part to play. But it's just always important to just keep a balance. And as I've mentioned, disease has no discrimination. So you can gym, but that does not necessarily mean that. But you can just use gym as a preventative measure. Yeah.
Okay. So going back to, like I told you, I know two people in their early 30s, late 20s, who actually had cancer, which was discovered late.
Sure.
Why is that?
I think that is the biggest problem. I think especially kuti abantu abamtsundu, like especially for us people of color, particularly I think also in black families. I mean, I had an aunt who was unfortunately diagnosed late. You know that thing of living in the village, you just have a pain, you go to the clinic, they say here's paracetamol, you know. So it took time for them to discover it, but fortunately once it got discovered, she had that cutting off the breast and then it was better. But again, we don't have a culture of checking such things. You see, we don't even have a culture of just checking our bodies, you know, and just seeing, but oh, this feels off. Oh, I have a bump on my vulva. Oh, it feels like I have something here on my hidden area.
Or just generally checking on yourself.
Touching yourself is a no-no. It's like, what are you doing? You know,
True.
You almost seen as a criminal. But why are you examining so much? It's not something that's taught, and I think that's why there's always late detection. Self-checks are things that we don't normally prioritize, and those annual mammograms, it's not things that we normally prioritize. And most oftentimes, I think when you're young and you're thinking you're living healthy, and most oftentimes, sometimes also when you have lumps on your breast, it's not necessarily a thing of, okay, you're ill. It can be just hormonal, or you're on your period, or you exercised too much. I think that's why people tend to just leave things hanging. But culture, for me, from my perspective, is what has caused late diagnosis, because we don't cultivate a culture of people just checking.
Okay. And so because we find out late, does that mean we have worse outcomes? Or like, what is the situation? Because if I found out late, I'm assuming it's dead. I have 3 months left. You know?
Yes, it's very important when life happens. Being calm, I've learned, in many situations will save you a lot of trouble.
Yeah.
Because most oftentimes, even when you look at, there's research that shows that oftentimes the people that take the diagnosis to heart and, you know, play it in their minds and get stressed, those people are the ones that actually die earlier. But a person who takes in the diagnosis and doesn't personalize it and continues being in a healthy mental space, those people actually outlive the disease. To your question of late diagnosis is equal to death, it's not. It's not that. Fortunately, I think the medical field has advanced to a stage where it's able to do targeted therapies, or there's surgeries that need to be done. But it's important to just discuss the treatment alternatives that are available for you for that particular stage. And again, early diagnosis, in the sense that self-checks are very important. I think that's the major thing. But I will say that when it's discovered later, it tends to be at a point where it's quite actually aggressive. So I do get your point about late meaning death, but that's not always the case, because a person can undergo a mastectomy, or like have a chemotherapy, which is harsh. But because generally therapies, I do want to mention that they don't just target the cancer cells, they sometimes target all the cells that are just growing. That's why sometimes people will have their hair falling off. But late diagnosis does not necessarily mean death, guys. It's important to keep calm and just see what alternatives there are to try and save yourself.
So now, speaking of hair falling off, we lose our hairs. I'm assuming you go through surgery when you have to go past chemo, you lose your breasts. Doesn't that, in a sense, affect your body image, and how do you move it through that?
It most certainly does. I don't wanna lie, because I mean, as women, we love our hair, we love our bodies. You know, you'll put on that crop top and you're like, oh, I look snatched, you able. So now all of a sudden you have one boob. All of a sudden you literally have a cheese scope, not one you applied for, one that came because of undesirable circumstances. And it does most certainly affect you as a person. We're able. But I believe this is where we need to emphasize the importance of community. This is things like this are not things that a person can go through alone and just be fine. Again, no man is an island. Community is very important, and understanding that it's a diagnosis, but it's not an identifier. It's not necessarily something abazalti. This is who you are, but it's you. You are that person. People just need to understand that, and to also know but even the transformation of losing hair is not talking to how weak they are or how they've lost their identity, but it shows how strong they've been throughout the process. But also, again, most certainly, that thing of
It's fine.
Yeah, there's a cut. Go to the next question.
Okay. So tell me, let's say I have cancer. I find out I have cancer, and I'm 31. I don't have kids. I'm going through that journey. It's an emotional, distressful journey, fighting for my life.
Sure.
But I still need to think of my future.
Yeah.
You know, I want to have kids, my husband. I need, you know, how do we maneuver through that? How can I maneuver through that, or someone my age maneuver through that?
Well, that's a great question, actually, because most oftentimes the therapies that people undergo can have an effect on fertility. And it can sometimes just affect also the health of the eggs, especially chemotherapy and radiation therapy. But you often hear doctors sometimes sort of proposing to their patients that they freeze their eggs. There's always there's always pathways that the doctor can always advise, and it's important for people to think that far and to know that that diagnosis does not necessarily mean that now all your plans of raising a family are completely destroyed. But keep an open mind, and there have been people who've done that in terms of freezing their eggs or preserving them for a later stage, so that they just pass this hurdle and then they can later on continue having their families, and they've had very successful pregnancies. So it's also very important just to sit down and have those conversations with the healthcare provider, because they know best. And since everyone is different, each person will have sort of a personalized path to take to that level of making the decision.
And I would assume through this journey, you need that community.
Most certainly.
You need, like you said, you need that support. And how can I, you know, I wish I was there through the people that, you know, suffered through cancer, to support them, but I just didn't know because I'm awkward.
You don't know
I was like,
how,
sorry,
and
then I
yeah,
called
and
it
you
a
can't
day.
say sorry.
And I called it a day, but how can I further support them, you know, in their journey outside of, so it's going to be fine, you know?
And that's one of the, actually, that thing of, so it's going to be fine. It's like almost when someone tells you that they've lost someone that they love, and you're like,
My condolences.
It's going to be fine. Oof. It's important that when we give advice, we are very present and we understand the things that we are saying. In the case of cancer, it's important to understand that sometimes you don't need to be that person that's constantly talking about encouraging and all of that. You just need to be present and be there for the person and just go through it with them, depending on how they want to go through it, and not be that person who has that toxic positivity. Just understand how the person feels. Sometimes you just need there to listen. Oh, what do you need? What can I do for you? Oh, do you want us to do this? Do you want to take a walk? Things like that.
Yeah.
It's important to be present. And yes, it can be awkward at times because you just don't know what to do. But you'll be able to read the loved one. They'll be able to guide you towards what they want. But the most important thing is just be human and go through it. And of course, therapy also always helps. And also just encouraging the person to talk to a professional, or you guys can talk depending on the depth of the relationship that you guys have. But the most important thing is to just stay at a non-judgmental space and be there, be an anchor when they need one.
Okay. You know what? I feel like I've learned so much in this session, in like just this chat, and I would just like to find out more, but obviously later following sisterhood.
Follow.
And I'm just grateful for the session. Thank you very much.
Thanks, Letty. Those questions were really eye-openers. And I actually also went through that. My aunt was once diagnosed. Did I mention this?
Yes, I think, yeah.
But yeah, it's very difficult because at the same time, the person is going through their emotions and trying to understand what's happening, and regulate their own emotions. And then you are this external person that's just there pretending like, it's gonna be fine. But the thing is, sometimes that's not what they want to hear. Sometimes
you know it's not going to be fine. You know you're going to
Exactly.
have it. It's going to get bad
Exactly.
before it gets better.
And you just need someone who's just going to be there, non-judgmental with you. And I think it's also very important to have these conversations constantly. These are not everyday conversations. I mean, we'll talk about what happened at Groove. We'll talk about Maletsati's dance moves and how she did Vosho and Opetsa. But these ones,
they never happen. We'd rather talk about that heartbreak.
You'd rather talk about that heartbreak, exactly. When it comes to our health, no one wants to mention anything, to the point where if someone has a challenge, intimate area, what, people don't want to talk about it.
All right. Thank you very much.
Oh, do you want to shake my hand?